Major changes are now in motion across the National Health Service, and they are set to affect every senior citizen registered with a GP in the United Kingdom. Starting April 12, 2025, the way GP practices operate, and more importantly, how they deliver care to older adults, is undergoing a significant transformation. These changes are not optional. They are already in force, and if you or someone you care about is over 60, it is absolutely essential to stay informed and take the right steps now to avoid missing out on critical healthcare services. Under the new NHS guidelines, certain GP services that were once automatically renewed will now require seniors to confirm their continued need or eligibility. This includes regular health checks, repeat prescriptions for long-term medications, and access to some forms of home visits or community nursing. For the first time, GP practices will be held to stricter digital communication standards, meaning more reliance on patient portals and online booking systems, something that may pose challenges for older adults who are not digitally confident. Even more concerning is the rollout of a new patient re-registration initiative, aimed at freeing up inactive GP lists. Seniors who haven't had a face-to-face appointment in the last 12 months may be marked as inactive and could risk being temporarily removed from their GP's list unless they confirm their status. This could delay access to urgent care or referrals if it goes unnoticed, and it doesn't stop there. Local integrated care boards are also adjusting how they prioritize older patients for certain services, including physiotherapy, diabetic checks, and even mental health support. In some regions, automatic invitations for health screenings are now paused unless you manually opt in. This isn't about scaring anyone, it's about making sure that no one falls through the cracks. The time to act is now. Don't let silence be mistaken for inaction. We're going to walk through everything you need to know, step by step, so you're not left behind. Stay with us, and be sure to like this video and subscribe for weekly updates that truly matter to you and your health. Now, let's break this all down in a way that truly makes sense. Because let's be honest, when it comes to NHS announcements, things can often sound more complicated than they need to be. But at the heart of it, what's happening from April 12, 2025, is a major shift in how GPs communicate with their patients, especially older adults who rely more heavily on consistent, accessible healthcare. These changes aren't just a few tweaks here and there. They represent a restructuring of how your relationship with your GP is maintained. And for seniors, that could mean the difference between receiving timely care or being unknowingly left out of essential services. Let's start with the most pressing issue. Automatic renewals for services like repeat prescriptions and routine checks are now being phased out. If you've grown used to your medication being reissued without needing to check in with your GP, you might be in for a surprise. NHS England is introducing new protocols that require seniors to reconfirm that they still need certain repeat medications. That means no more passive renewals. You'll need to log into the NHS app, call your surgery, or in some cases, visit your GP to reconfirm your need for those medicines. Now, for someone who's already managing several prescriptions, this can feel like just one more hoop to jump through. But it's a necessary change the NHS says is aimed at reducing waste and improving medication safety. Unfortunately, that also means seniors who aren't fully aware of this change could suddenly find themselves without critical medications if they don't act quickly. Equally concerning is the rollout of the new, digital-first, contact model. The NHS has been encouraging online communication for a while now, but this is the first time it's being baked directly into the way GP surgeries are evaluated. That means your local practice is under pressure to move as many patients as possible to use apps, email, or web portals instead of phoning or walking in. While this might sound fine in theory, it's not always practical. Many older adults are not comfortable using smartphones or don't have regular internet access. And yet, under the new rules, practices will now prioritize digital contact first, with traditional methods being considered secondary. The implications of this are massive. If you or someone you know has relied on calling up the surgery to speak to reception, that may soon no longer be the first option offered. In some areas, phone lines are already beginning to automatically direct people to online systems. What does that mean for you? It means you might have to learn how to navigate the NHS app or work with a family member to help set up digital access. And while we wish there were more support from the government to help seniors with this transition, right now, most of the responsibility is falling on patients to adapt. That's why staying ahead of this change is so important, because the sooner you become familiar with these systems, the more empowered you'll be to keep control of your healthcare. Now, let's talk about the re-registration program that's quietly being rolled out behind the scenes. This part is especially worrying. In an effort to clean up GP records, NHS England has given practices the green light to begin flagging patients as inactive if they haven't had contact within the past 12 months. That includes phone calls, appointments, prescription renewals, any sort of activity. If you fall into that category, your GP surgery may send you a letter or text asking you to confirm that you're still living in the area and still want to remain registered. If you don't respond in time, you could be deregistered. Yes, you heard that right. You could lose your spot with your local GP just for not replying. And with NHS capacity already stretched, getting re-registered could take weeks, even months. We've already heard from a few people who were surprised to find out they were no longer on their GP's list. One gentleman, 74, from Kent, hadn't visited his GP in over a year because he was managing his blood pressure well and had no pressing concerns. He only discovered he'd been deregistered when he tried to book an appointment for a routine blood test and was told he was no longer listed as a patient. Re-registering required multiple calls, ID checks, and a wait time of several weeks before he could get back on the books. For older adults, this isn't just inconvenient, it's potentially dangerous. That's why we can't stress this enough. If you receive any communication from your GP asking you to confirm your details, respond immediately. Don't wait. A quick phone call or text reply could save you from being dropped from your practice entirely. Another major change that's coming with this NHS overhaul is how integrated care boards, or ICBs, are now handling care prioritization for older patients. You might already be aware that the NHS is now structured into regional care systems that manage services across entire areas. These are the ICBs. Well, as part of the April reforms, ICBs have been given more autonomy to decide which services are offered automatically to older patients and which ones must now be requested manually. This includes annual diabetes checks, physiotherapy referrals, mental health support for seniors, and even home visits in some rural areas. What this means in practice is that you can no longer assume your next checkup or follow-up appointment will be scheduled automatically. In some areas, those appointments now need to be proactively booked by the patient. Miss a reminder letter? Don't follow up? You could easily fall off the radar. And that's especially troubling when you consider that many age-related conditions, like macular degeneration, arthritis, or mild cognitive decline, require regular monitoring. Without that consistency, conditions could worsen before anyone notices. The good news is that you're not powerless here. By being proactive, you can make sure that these changes don't leave you behind. Start by calling your GP surgery and asking them how these new rules are being implemented locally. Are they still sending reminders for screenings? Do you need to opt in for certain services now? These are fair questions, and your surgery should be prepared to answer them. If they aren't, don't be afraid to ask them to escalate your query to the practice manager. You deserve clarity. On the subject of screenings, some of you may have noticed changes to how invitations for things like bowel screening or mammograms are being issued. Previously, these were automatically sent out by the NHS based on your age and risk category. Now, in certain pilot regions, these invitations are being paused unless you opt in. The reasoning behind this is part of a broader NHS strategy to focus resources on those who actively engage with preventive care. But again, the downside is that many seniors who assume they'll be contacted might end up waiting indefinitely. So the message here is simple: if you haven't had a screening invite in the past year, don't wait, call and request one. Let's also touch briefly on NHS staffing, because this ties directly into why many of these changes are happening. Across the country, GP surgeries are struggling with recruitment and retention. There simply aren't enough doctors to meet demand, especially with an aging population. As a result, the NHS is pushing surgeries to manage patient flow more efficiently, which often means fewer face-to-face appointments and more reliance on triage systems. This is another key area that seniors need to be aware of. More and more, when you contact your GP surgery, you'll first speak with a care navigator or receive an online questionnaire that determines whether you actually need to see a doctor. While this can be frustrating, it's part of a broader strategy to prioritize urgent cases. But here's the issue: some seniors have complex health needs that can't easily be explained in a drop-down menu or a 5-minute call. If you feel like your concerns aren't being taken seriously or you're being fobbed off with online advice when you know you need a real appointment, don't back down. Be persistent. Ask for a clinic and call back. If that doesn't work, write directly to your practice. You are well within your rights to advocate for your own health, and under NHS guidelines, every patient has a right to appropriate care, regardless of age or digital ability. Now, before we wrap up, let's talk about what you can actually do today to protect your access to NHS care under these new rules. First and foremost, get in touch with your GP surgery to confirm that your registration is active and up to date. Don't assume, ask them directly. While you're on the line, find out if any of your services require reconfirmation, such as prescriptions or annual reviews. If you're not comfortable using the NHS app, consider asking a trusted family member to help set it up, or speak to your surgery about alternatives for those who aren't digitally connected. Secondly, ask your surgery whether they are part of any of the pilot schemes involving screening Opt-INS or digital first triage. Each region is handling the changes slightly differently, so local knowledge is key. And if you encounter resistance or confusion, don't let that stop you. Politely insist on answers, because your health depends on it. Lastly, consider joining a local patient participation group if your surgery has one. These groups give patients a say in how services are delivered, and with so many changes underway, now is the perfect time to get involved. Your voice matters, especially when it comes to shaping care for older adults. We know this is a lot to take in. But the goal here isn't to cause worry, it's to empower you with the facts. The NHS is changing, and while not all of those changes are easy or ideal, understanding them now gives you the power to respond. Too many seniors only find out about these shifts when it's already too late, when they've missed a critical appointment, or when they've lost access to their regular GP. That doesn't have to be your story, so take action today. Call your surgery. Ask the questions. Get clarity. And if you're feeling overwhelmed, you're not alone. That's why we're here, to guide you through it, week after week, with honest, reliable updates that put you first. Subscribe now, leave a comment if you've already experienced some of these changes, and let's continue this conversation together. Because staying informed is the best medicine we have.